Turkey today is uniquely positioned to offer excellent medical value to patients from every corner of the globe. The concept of medical tourism in Turkey blends the country's worldwide reputation for high-quality physicians, advanced surgical treatments, precise diagnostics, attractive pricing, luxurious 5-star hospitals, quick response time and beautiful holidays. Turkey's academic and teaching institutions are universally recognized for their high levels of achievement and for the exemplary training of its doctors. Turkish doctors evidence high visibility in the international arena, as lecturers at medical schools and hospitals, as visiting experts or presenting papers at international conferences. Turkey is distinguished by institutions of research and higher learning that have achieved global acclaim. Researchers in these laboratories have developed many inventions to help fight diseases and illnesses. The use of modern technologies, techniques and devices minimizes both the duration of the surgery and the recovery period, adding to the patient's quality of life. Turkey has an expanding network of ultra-modern hospitals and medical centers that are either privately financed or state-owned. Well-staffed and fully equipped, these facilities are highly efficient and among the most advanced in the world. They have the capabilities to respond to the complex needs of modern medicine, from initial diagnosis, hospitalization, post-operative intensive care and physiotherapy, through to patient rehabilitation. Turkey offers world-class medical professionals and healthcare solutions for less than any comparable environment, with almost no waiting time. Turkey's medical expertise and institutions provides excellent healthcare cost value with up to 60% price advantage compared to those of the USA and Europe. Patients doesn't have to compromise on price or quality, they can get both in Turkey. Hosting over 1 million visitors for medical tourism in 2019, Turkey possesses a plethora of qualities and inherent advantages and ranks among the top 10 source countries in medical and health tourism. Setting out plan to become major global medical tourism hub in 2020, Turkey's ultimate aim is to promote innovation and ensure international patient access to highest quality treatment.
Good evening, everyone. My name is Idil Saguner. I am the president of International Health Tourism Association. Mrs. Felicia Iriogbe is with me here. Felicia is the association's regional council for Africa, and she is a strong advocate for sustainable medical tourism. Welcome, Felicia. How are you?
I'm fine, thank you. Thank you so much for having me on board.
Very nice to see you. We are incredibly lucky today to have Dr. Bunyamin Yavuz with us, who is the renowned interventional cardiovascular disease specialist and one of the youngest cardiology professors with huge experience to perform over 10,000 cases. He's going to answer some of our questions about our heart health today. Welcome, Doctor. First of all, a huge thank you for joining us.
Thank you, Idil. How are you?
Thank you. We are very well. Of course, we all know you very well, but I want our international audience also to get to know you better. Please tell about yourself, Idil.
Okay. I'm a medical doctor and I'm a cardiologist. I'm interested in interventional cardiology, arrhythmic disease, and hypertensive disease, and heart failure. And I'm working at a university hospital in Turkey, and I live in Ankara, the capital of Turkey.
Thank you. So, doctor, please tell us, Why would one need to see a cardiologist?
Okay. Our patients presents a chest pain, shortness of breath, or palpitation, faint, lots of symptoms like that. Chest pain is a very important symptom for us. Chest pain may be related to coronary artery disease. This is related to heart vessels. And if you have a chest pain with exercise, it's very important for us. And shortness of breath is another important symptom for us. Our patients' heart failure presents shortness of breath. Palpitation is another symptom for us, and it's related to rhythm disturbance. Okay.
Yeah. Okay. Let's talk about new diet trends, like keto diet. I don't know how the keto is the right pronunciation. I don't know.
Keto.
Keto. Sorry, keto diet.
No problem.
Does it protect the heart?
There is not one diet that's good for everyone.
Please, can you reduce that one?
Yeah. People following the keto diet should be eating foods like fat fish, eggs, meat, butter, oils, nuts, seeds, and low-carb vegetables. Fat bombs like unsweetened chocolate or coconut oil can help people reach their daily goals for fat intake. Keto diet may result in weight loss and lower blood sugars. The keto diet could cause low blood pressure, kidney stones, constipation, nutrition deficiency, and an increased risk of heart disease. Strict diets like keto could also cause social isolation and disordered eating. Keto is not safe for those with any conditions involving their pancreas, liver, thyroid, and gallbladders. So, diet is very important for all people, but there is not one diet for everyone.
Yeah. How about vegan or vegetarian?
People who eat vegan or vegetarian diets have a lower risk of heart disease, but a higher risk of stroke, possibly partly due to lack of B12 vitamin. Researchers found that those who didn't eat meat had 10 fewer cases of heart disease and 3 more strokes per 1,000 people compared with the meat eaters. Hemorrhagic stroke is caused by bleeding in the brain. While low cholesterol is protective for heart disease and ischemic stroke, there is some evidence showing that low cholesterol levels may be linked to a small risk of hemorrhagic stroke. Vegan or vegetarian diet, not only diet for everyone too.
Okay.
Okay.
So do we need to cut out sugar?
Sugar is a very important subject in whole world. too much added sugar can be one of the greatest threats to cardiovascular disease. The higher intake of added sugar, the higher risk of heart disease. Sugar actually affects heart health is not completely understood, but it appears to have several indirect connections. For instance, high amount of sugar overload the liver can lead to a greater accumulation of fat, which may lead to fatty liver disease. A contributor of diabetes, which raises your risk for heart disease. The American Heart Association suggests that men consume no more than 150 calories. It's about 9 teaspoons or 36 grams of added sugar per day.
So, what is the best diet for our health? Felicia, I'm asking this question for you. I know you, yeah, you like to hear these things very much.
Yes, I do.
Yeah, that's very good question. Studying the impact of a total dietary pattern theoretically shows the full preventive potential of diet, since it yields a combined estimate of the impact of several favorable dietary habits. The Mediterranean diet compares many of nutritions and foods that have been discussed previously. High intake of fruits, vegetables, whole grain products, fish, and unsaturated fatty acids. Moderate consumption of alcohol, mostly wine, and low consumption of red meat, dietary products, and saturated fatty acids. Saturated fatty acids to account for smaller than 10% of total energy intake. Trans-unsaturated fatty acid as little as possible, preferably no intake. Fish 1 to 2 times per week, one of which to be oily. 30 grams of unsalted nuts per day. Consumption of alcoholic beverages should be limited 2 glasses per day. For men, 1 glasses per woman. That's important.
2 glasses per day. Wow.
2 glasses per day, yes.
Great.
Yeah. Sugar sweetened soft drinks or alcoholic beverages consumption must be discouraged. Oh, that's really important to have Mediterranean diet, and there is only one diet in world decreased risk of heart disease.
Mediterranean diet.
Yeah, Mediterranean diet.
Felicia, you know about Mediterranean diet?
We had some when we went to Turkey last time.
Yeah.
So, doctor, what is the latest advice on daily aspirin therapy?
Aspirin therapy, that is a questionable. Aspirin should be used infrequently in routine primary prevention of coronary artery disease because of lack of net benefit. Because there is some benefit preventing heart attack, but increased risk of gastrointestinal bleeding.
Oh.
low the aspirin 75 to 100 milligram orally daily might be considered for secondary prevention. Low dose aspirin should not be administered for primary prevention among adults any age who at increased risk of bleeding. That's very important. 75 to 100 milligram daily, if needed. The patient should visit their doctors, and their doctors should decide for using aspirin therapy.
Or not using, yeah.
Or not using.
A doctor should tell them, of course. So for a long time, we know that smoking is not good for heart. How about e-cigarettes, doctor?
Yeah, that's a really important subject. Smoking is a very bad habit and really important for cardiovascular health. Electronic cigarette use rapidly increasing among youth and adult despite limited information regarding long-term risk of or benefits. It will be important for healthcare community to remain informed about emerging research on e-cigarette use and associated health risk, especially in light of information suggesting the potential for adverse cardiovascular and pulmonary effects from exposure to nicotine and inhalation of chemical in e-cigarette vapors. There is still much to be learned about behaviors associated with e-cigarette or e-liquid use and their potential health effect that may also influence the risk of benefit ratio for current users of conventional cigarettes who are considering switching to e-cigarette use. I don't advise use of e-cigarette usage.
Okay. So, doctor, how much sleep is best when it comes to protecting our heart? How much sleep do we really need?
Sorry, I don't understand the question.
How much sleep is best when it comes to protecting our heart?
Okay, sleep. The amount of sleep you need depends on various factors, especially your age. In newborns, it's recommended 14 to 17 hours a day. For 12 months child, about 10 hours at night plus 4 hours of naps. 2 years children, about 11 to 12 hours at night plus 1 to 2 hours after nap. 3 to 5 years children, 10 to 13 hours. 6 to 13 years, 9 to 11 hours. 14 to 17 years, 8 to 10 hours. For adults, 7 to 9 hours. In aging category, older adults need about the same amount of sleep as younger adults. As you get older, however, your sleeping patterns might change. Older adults tend to sleep more likely for shorter time spans than do younger adults.
Very true.
Sleep medicine is really important for heart disease because if you don't sleep, if you don't sleep necessarily, you have high risk for heart disease.
Wow.
Okay.
Okay, doctor. What type of exercise deliver the most heart benefits? What type of exercise?
In guidelines of American Heart Association,
Okay.
they advise that we should exercise 20 to 30 minutes in a day in aerobic exercise. The most studied and recommended modality with a beneficial dose-response effect on prognosis consists of movement of large muscle mass in a rhythmic manner for a sustained period. That's very important, a sustained period. It includes everyday activity, including active travel, cycling, walking, heavy household work, gardening, occupational activity, leisure time activity, or exercise such brisk walking. Nordic walking, hiking, jogging, running, cycling, cross-country skiing, aerobic dancing, skating, rowing, or swimming are also advisable. It's recommended that individuals accumulate at least 30 minutes a day, 5 days a week of moderate intensity.
Okay, that's good to know. What effect might our electronic devices, say something like a mobile phone, Bluetooth, have on our hearts?
Yeah, it's also a current problem. Repeated Wi-Fi studies show that Wi-Fi causes oxidative stress, sperm testicular damage, neuropsychiatric effects of EEG changes, apoptosis, cellular DNA damage, endocrine changes, and calcium overload. The release of non-steroid hormones is preceded by VGCC activation and calcium elevation. The intermediate effects of electromagnetic frequency exposure is to increase hormone release and raise, therefore, hormone levels. However, many hormone systems become exhausted as a consequence of chronic electromagnetic frequency exposures. The mechanism exogenous is still uncertain, but it may involve oxidative stress and inflammation. I think further studies are needed.
Oh, okay.
Yeah, I have a question. We know there's a strong connection between stress and heart diseases. Is there any new information we should know about this?
Yeah,
stress is also an important subject for us. Acute mental stressors may act the triggers of acute coronary syndrome, heart attack. These stressors include exposure to natural catastrophes as well as personal stressors, resulting in a acute strong negative emotions. After the death of a significant person, the incidence rate of acute myocardial infarction is elevated 21-fold during the first 24 hours, declining steadily during the subsequent days. That's important. Chronic stress at work predicts premature incident coronary artery disease in men. In addition, long-term stressful conditions in family life increase coronary artery disease risk. Assessment of psychosocial factors in patients and persons with cardiovascular risk disease should be considered for use of risk modifiers in cardiovascular risk prediction, especially in individuals with score risks near decisional thresholds. In addition, psychosocial factors can help identify possible barriers to lifestyle changes and adherence to medications.
Thank you. Doctor, nowadays people are digging into their genes to learn about their heart disease risks nowadays.
Yeah.
How helpful is this? What do you think?
Yeah. For more than a decade, researchers have been using genome-wide searches and find genetic clues linked to cardiovascular disease risk. They have found millions of spots on the genome, which taken individually only convey one piece of a very large puzzle. But taken together, these single nucleotide polymorphism, a kind of genetic terminology, which are single letter changes across the genome that vary from person to person, can be grouped to better predict disease. In genetics, these groups are called polygenic risk factors. Some researchers want to use these risk scores, this genetic risk scores, much the same way that single gene variants can predict cancer or unusual high cholesterol disorder called familial hypercholesterolemia. The problem with these scores is that they are associated with risk, but not enough to be useful in a clinical context. There is no one gene for detecting coronary artery disease or heart disease. There is lots of genes, and that's a polygenic structure.
So how might our gut microbiome can affect our heart health?
Yeah, probiotic is very famous now. I think you hear about probiotic. The gut microbiome functioning as a virtual endocrine system communicates with distal organs through metabolic dependent pathways. Significant interest in recent years have focused on gut microbiota host interaction because accumulating evidence has revealed that intestinal microbiota play an important role in human health and disease, including cardiovascular disease. Multiple human clinical studies reveal striking associations between either gut microbiota composition or their derived metabolites and both the presence and incident development of cardiovascular disease, we need time to understand and develop protocols in this area. I think further studies are needed too.
But it has a great importance.
Yeah.
I think.
So, doctor, is it true that women are more likely to have a typical symptom than men experience?
Yeah. Oh, that's really important subject. Systematic cardiovascular risk assessment is recommended in individuals at increased cardiovascular risk. For example, with family history of premature cardiovascular disease, familial hypercholesteremia, major cardiovascular risk factors such as smoking, high blood pressure, diabetes, or raised lipid levels, or comorbidities increasing cardiovascular risk. It's recommended to repeat cardiovascular risk assessment for 5 years for individuals. In women, systematic cardiovascular risk assessment may be considered higher 50 years or postmenopausal with no known cardiovascular.
Turkey today is uniquely positioned to offer excellent medical value to patients from every corner of the globe. The concept of medical tourism in Turkey blends the country's worldwide reputation for high-quality physicians, advanced surgical treatments, precise diagnostics, attractive pricing, luxurious 5-star hospitals, quick response time and beautiful holidays. Turkey's academic and teaching institutions are universally recognized for their high levels of achievement and for the exemplary training of its doctors. Turkish doctors evidence high visibility in the international arena, as lecturers at medical schools and hospitals, as visiting experts or presenting papers at international conferences. Turkey is distinguished by institutions of research and higher learning that have achieved global acclaim. Researchers in these laboratories have developed many inventions to help fight diseases and illnesses. The use of modern technologies, techniques and devices minimizes both the duration of the surgery and the recovery period, adding to the patient's quality of life. Turkey has an expanding network of ultra-modern hospitals and medical centers that are either privately financed or state-owned. Well-staffed and fully equipped, these facilities are highly efficient and among the most advanced in the world. They have the capabilities to respond to the complex needs of modern medicine from initial diagnosis, hospitalization, post-operative intensive care and physiotherapy, through to patient rehabilitation. Turkey offers world-class medical professionals and healthcare solutions for less than any comparable environment with almost no waiting time. Turkey's medical expertise and institute.
Can you have a heart attack and not know it?
Yeah, it can be possible because especially in diabetic patients, silent coronary ischemia and silent myocardial infarction, heart attack can be possible.
So which heart screening tests do you recommend, doctor?
Firstly, I advise the patients they should be examined by a cardiologist, and then if they have a chest pain, we advise firstly exercise treadmill test. If we have a positive result in exercise test, we advise performing coronary angiography.
Okay.
Doctor, hear my question again. How do you think Turkey ranks cardiology and heart surgery?
Turkey is a very big country, especially in health tourism is very, very important in Turkey. Turkey is a very cost-effective country. For example, if you have a chest pain and you should be performed a coronary angiography or bypass surgery. In United Kingdom, you should pay 30,000 pounds, or in USA, you should pay 30,000 US dollars. In Turkey, that's very, very cheap price and very good quality surgery and good quality angioplasty and stenting. It's really cost-effective country.
That's good. Do you give clients detailed information of the problems solved for them? Do you give them detailed information of the problem you have solved for them when they have to go away?
Sure. If the patient come to Turkey and for visiting or health tourism or for treatment of disease, lots of doctors can give lots of detailed information about disease or treatment.
Okay, now after treatment in Turkey, do you give your clients an opportunity to keep in touch with you?
Yeah, sure. If a patient comes to Turkey after treatment, we can give our client an opportunity to keep in with us.
What happened?
I don't know.
Okay. What would you like to advise everyone generally? Health living, what would be your advice?
Idil, maybe you can answer this question.
For me?
I don't.
What would be your general advice? Your general advice.
Idil.
Hello, Idil, are you there?
You see me now?
Yes.
Okay. Sorry, you want me to answer a question, doctor? How can I? What you do yourself, keeping your diet healthy and keeping your heart healthy?
Sorry?
What you do for yourself to keep your heart healthy?
Oh,
Doctors usually.
I'm really careful about diet. Mediterranean diet is the best for me. Fish intake, wine intake, nuts
Wine
intake.
intake is good for health, do you think, really?
Yeah, two glass of wine for men.
And one for women. Okay,
Yeah.
great.
I'm sorry.
Fish intake and Mediterranean diet, vegetables, and of course, sports, making sports and so on.
Exercise.
Exercise, sorry.
5 days a week, 30 minutes a day.
30 minutes a day. Okay.
Izzy, can I ask you a question?
Yeah.
Yeah.
Good. Why would anybody want to come to Turkey for medical tourism?
I mentioned about it. It's really a cost-effective
Very
health
true.
services
And then also,
quality health services.
very true. And also, you find out that in Africa to Turkey, the flight distance is not much.
Yeah.
Yeah.
It's not much. So it's logical for people to.
That's very logical.
Yes, to assess Turkey, you know, in my thinking.
The prices are very, very cheap.
It is, comparing to European countries, it is around 55–60%, if I'm not wrong.
Okay.
Doctor, is it true?
Yeah.
Yeah. Less, of course, 55–60% less.
Less.
And there you have the best physicians, best doctors, state-of-art facilities, and Turkey is a tourism country also. So hospitality is very good quality. Treating patients is a high quality. Many reasons.
There is no procedure, heart procedure, cardiac procedure we couldn't make.
Wow. Oh, this is good to know.
Yeah.
I did a little investigation on you, doctor, and I noticed that you had been in this field for 19 years. True?
Yeah.
Yeah.
Wow. That's great.
Yeah, he's one of the youngest professors, but he has been doing procedures since 19 years, over 10,000.
Yeah.
Congratulations, doctor. And thank you very much for your time and everything you have done to make the world a better place, a healthier place, really. Thank you very much.
Thank you.
So, International Health Tourism Association is a non-profit organization partnering with the Turkish healthcare industry to help them provide world-class, affordable medical care to millions of patients seeking trustworthy solutions and successful outcomes. Our next show, Assistant Professor Dr. Ebru Soy will be with us to talk about general surgery. It's on 26th. Don't miss. Thank you. Goodbye. Thank you, Felicia. Thank you, Mr. Yavuz.
Good night.
Bye.